These are really exciting times for public health, but also for the fields of vaccine and immunization. Some 30 years ago, smallpox was certified as eradicated, and the Expanded Program on Immunization, EPI, was established. 30 years later, what we got with immunization is the following. We have 4 times more vaccines available and recommended for use by WHO today in comparison to the 80s when EPI was established.
This GVAP was written by over 1,000 people, as was already said, from more than 150 countries, more than 280 institutions in the world. So this, I think, is unique in the history of WHO. But there is another unique thing. It's the first time in the history of this organization that a resolution calls for a review of this activity every single year by all member states, by reporting to the regional committees. And this is unique in the whole history of the organization, and is an incredible approach of accountability of the countries to one another, every year reporting back to the organization.
By the end of the decade, parents and communities are the most critical if we are going to see immunization as a right, and it is important for the communities and families and parents to see immunization as a right, and not just be wanting immunization for their children and for other children, but demanding immunization for all children in their communities and societies.
We are incredibly committed to this process and to the GVAP. The secret or the importance of the Global Vaccine Action Plan is the incredibly powerful role vaccines can and do play in improving women's and children's health. And by the way, it's not just death, it's morbidity, it's healthy families. And GAVI supports this plan. And of course, critical to everything we do is the co-financing of vaccines by countries. Again, engaging not just the ministries of health, but the ministries of finance in this. So this is very important.
In Ghana specifically, important progress has been made with our expanded program on immunizations. Currently, Ghana provides vaccination for children under 1 year of age against 11 childhood killer diseases.
Where we in the Democratic Republic of Congo, together with a consortium of NGOs, and again in partnership with the Ministry of Health and supported by GAVI, send our volunteers out to households to find children who are unvaccinated, who are not attended the regular services, and try to convince them to come to the regular vaccination. And again, here it was the information, but as well as the trust which we could establish. The trust we could establish because our volunteers were there, they're coming from the community, they are part of the community, and that was an essential part.
Since 2002, we managed to do the following. To introduce new vaccines, strengthen the capacity of the human resources, both managerial and technical, to expand and rehabilitate the cold chain to cope with the new vaccines. All these inputs help us to raise the coverage rates of pentavaccine to more than 90%.
So immunisation, I think, is arguably one of the greatest health success stories of the last century and saves the lives of millions of children every year. And that's why it's so important to save the children, to see the progress increasing and gaining in acceleration.
GVAP is also about realizing the incredible potential of immunization in building and strengthening the health system, because it's really the vision that you have and you will have seen is really about nesting immunization and immunization system within a stronger health system. And it's one of the key principles is about country ownership.
We've ended up with what I believe is a rich and solid document, but that the strength is that it's the result of this rich and complex process, and that it contains what I believe is a common vision of what can be done and achieved over the next decade.